successful robotic excision of 4 complex linear pelvic masses by hospitals, 2 hospitals in Hyderabad, Medipatnam and Gachibowli. This is a Medipatnam hospital, this is a Gachibowli hospital in Hyderabad, kidneys and IVF centers. Now, this actually I have been practicing for past 36 years, and Indore urology, robotic surgery, infertility, andrology, and IVF. Now, this is the first case of pelvic myxosarcoma. A 45-year-old man presented with lower abdominal pain, no bladder or bowel symptoms, no loss of appetite or weight. Serum PSA was normal. There was a 8.3 into 5.8 into 6 centimeter pelvic space occupying lesion. MRI showed a large heterogeneous soft tissue near causing the close relation to the right lobe of the prostate, which is compressed and effaced. Now, core needle biopsy of pelvic mass showed spindle cells in bundles in myxoid stroma with moderate mitotic figures. Now, you can see here there is a cricket ball-like thing here behind the bladder and in front of the rectum, which was quite surprising, and a big one of mixed attenuation and echogenicity. This is the almost the size of the cricket ball here, and he was a young man of 44, taken up for robotic surgery because of the complex location as well as difficulty in accessing that pelvic area, which is abutting between the rectum and pelvis. We have a SI system here in King's Hospital, and this is the operated video, separation of mass between the bladder and rectum. It was done very carefully because it is likely to injure either bladder or rectum, and we didn't know actually how much it was attached or adherent or infiltrating the viscera surrounding. Unfortunately, we could actually take it out without injuring the vital structures and put it in a bag and then brought it out. This is the big tumor which was not very infiltrating, but we could actually separate it from the both are parts of recovery, 3 hours after surgery. Ultrasounds are recovered in 24 hours, brain removed 3rd day, discharged on 4th day, and after 1 year he is still doing well. So the study showed a biphasic population, predominantly spindle cells, interspersed glands showing mild to moderate hyperplasia on display, and areas of myxoid stain with mitosis and entrapping glands of prostatic organ. Impression is a spindle cell mesenchymal tumor of myxoid origin involving the prostate. That is a mullerian duct cyst. A 22-year-old man presented with lack of secondary sexual characters, was treated with hypogonadism with testosterone injections and occasional suprapubic discomfort. There was a little on the overweight side, and the chromosome karyotype was normal, 15 into 12 into 10 centimeter. Contrast intensity showed a pyriform shaped SOL in the pelvis of the 16 into 13 and 11 centimeter between bladder and rectum. Smooth walled and contains homogeneous fluid and not infiltrating adjacent viscera. There is no enhancement on the contrast injection. You can see abdominal fat and mild gynecomastia in the boy of about 18 years. Now, this is the mullerian duct as you opened. This also was attempted robotically. This is a pyriform shaped space occupying region, and if you see here, this is the bladder. It is abutting between bladder and rectum going up like that, and it was also taken up by robotic surgery. As we opened, this is a very placid and cystic, soft, pliable. So we aspirated it. We tried to separate it, and as it was tight, we just aspirated it. This is the dissection of the left horn of the mullerian duct cyst. You can see the left one is separated on the right side. The other horn was taken out very comfortably. When there was a difficulty in dissection, we aspirated, and there was a myxoid fluid inside the cyst. And after aspiration, the dissection became quite easy. It was adherent to pelvic wall, but not to the structures. Now, this is the specimen removed. The left horn is very big, well developed. Right horn is rudimentary. And this is the mullerian duct cyst in a male who was around 18 years. This is post-operative of surgery, second day of surgery, we were up and about, and the operative time was around 130 minutes. This is after 1 year of this, the actual abdominal fat has come down, the gynecomastia has come down, and third case is excision of retroperitoneal fibrosis. A 35-year-old man presented with vomiting, facial edema of 10 days duration. There was mild hydronephrosis, and creatinine was ranging between 1.5 to 4.5 milligram %.